Fighting fear and fiction with facts. It's the goal of this segment on the News at 9, where we bring in experts to discuss the COVID-19 pandemic and ask them questions we have, and perhaps most important, questions you have, our viewers. Tonight we are joined by San Antonio Metro Health Director Dr. Don Emerick. Thank you so much for joining us. First question I have is, what's your message to our viewers tonight?
Take a deep breath, just like I did, and follow the declaration that the mayor established, where social isolation or social distancing is the #1 priority for helping us to contain the spread of COVID-19. And the best way to do that is to mind all of the declaration, stay home. If you do have to go out and about for the grocery store or to get gas, or some of those other essential services, be sure to wash your hands. Make sure that you are coughing away from folks. Keep a strong distance away, a 6 foot distance away from everyone. And and then just hunker down and stay home. The best way to contain COVID-19 is to eliminate any of the interaction with people. And so let's just stay home and just try to follow the rules of the declaration.
All right, let's get to some of our viewer questions. The first one, what qualifications does a person have to meet to be tested for COVID-19?
So there's the standard criteria of looking at symptoms. So the symptoms could be a fever, a slight fever of 99.6, shortness of breath, and a dry cough. So those are the things that people are going to look at. Your provider is going to ask you whether you have those symptoms or not. The provider will then make a recommendation of whether you are someone that should get tested. If the provider is not able to make those tests or to test you at that time, then you can call the 311 hotline number, and they will get you connected to being screened and registered for the drive-through testing site that's over at the Coliseum.
Are you looking at all at changing those qualifications at a certain point or making it easier to get a test?
Yeah, we are. And as the local health authority, I do have, along with getting perspectives of the experts in the community, we can tweak that criteria. So we can do that at any time, and we are absolutely looking at expanding that criteria as we speak.
How many tests, the next question it kind of feeds into this, so let's get it. How many tests are available right now, and do you know when we're going to get more tests? Does that help set the parameters at all for who gets tested and who doesn't?
It does at times. So in the very beginning, the entire country was really struggling with getting the supplies that every community needed. The testing is the testing kit requires the swabs, it requires the test tubes with the medium in it, and there was a shortage across the country of being able to have the appropriate testing kit. In addition to that, the labs also was having a shortage in what's called the reagents. And so you kind of have to have the reagents to kind of cook the specimens, if you will, to process the test, and those were in short supply. Now those things are really starting to come around. We have more and more people that are testing, more and more labs that are coming online to process these tests. So right now, if I were to give you a count of how much around our community we could do a day, it would be 1,000. At any time today, we could process 1,000 tests. We do have the pre-approval drive-through that's over at Freedom. That is happening right now. They have ample supply of tests. We also have some clinics. We have Texas Med Clinic that has 19 clinics around the city that are also providing tests. And then Communicare, which is our 2 FQHCs. Well, they have 2 FQHCs in town, federally qualified health centers that are also testing.
Yeah, that's all great news. We actually talked to Texas Med Clinic last week during this segment, so I'm glad that you pointed that out. Now, I want to compliment Metro Health. I know you've been getting some heat about numbers and things like that. The dashboard as it stands today is a great resource for everybody in the community.
Isn't it amazing?
Yeah, sanantonio.gov if you have any other questions. But one of these questions actually comes from that dashboard. Do you think there's a reason why one of the city's most affluent zip codes, 78209, has a larger amount of confirmed cases?
Yeah, such a great question. And whoever looked at that, you're very observant, and I appreciate the question. So I'm going to go backwards just a little bit. We know that those positive cases, of the 168 positive cases that we have, one of the things that our epidemiologists do is to identify whether they are travel-related cases, close contact cases, or community spread. The travel-related is what we are looking at in that affluent area. What we're noticing is that those positives that are in that area were from folks who traveled. What we also know, and we don't know this for sure, but it also is a part, we're doing a lot of work around our healthcare providers and our first responders. And intuitively, that is where a lot of our healthcare professionals live as well. So we think that it is, looking at the data, that a lot of those were travel related, which is associated with the more affluent you are, the more that you're able to travel internationally. So it makes sense to us, but let's not take our eye off the ball here.
Yeah.
There are clearly a lot of other positives around the community. We also know that we have a lot of work to do to make sure that all testing is available to everyone in our community.
Absolutely. I'm glad you brought that up. All right, next question. It seems men are more greatly affected by the virus than women. I'm not sure that's necessarily the case for Metro Health, because it seems like the deaths that we've seen have been more women than men. But why does it seem to be nationwide more men are greatly affected by the virus than women?
So if you have to kind of look at the longitudinal aspects of the general health between men and women, the difference of men and women. We know what to be true is that men do die earlier than women. Women tend to be healthier in general than men. And so some of the higher chronic diseases that are associated with the behavior of men, the lifestyles of men. And so there's not necessarily a positive correlation to that, but we also know that coronavirus, if you have underlying conditions like chronic diseases, then the COVID-19 tends to place those folks more at risk. So it's not a strong correlation, but certainly there's an association. Now, here's the thing that's interesting. If that is indeed the case, what we're finding here, unfortunately, is the deaths that we have here in San Antonio, the majority of them are women.
Yeah.
So we don't have enough data to really make any type of inferences or conclusions at this time. I can also tell you that even the age range is not consistent with what we're seeing at the national level. We know that even those that are over 65 are more likely or more at risk for contracting COVID-19. However, our top age group for positive cases here is between 40 to 49.
Yeah. All right, next question. I love this question because there's a lot of concern that we're going to overstress our healthcare workers. This next question: should I still visit my doctor for non-coronavirus related issues, or should I use teledoc or telemedicine or whatever they're calling it?
You know, so I would talk to your individual provider. They will be able to tell you whether it is appropriate for you to come into their office. If your provider has telehealth, I would use it. If you have the ability to use telehealth, certainly use it. But unless your provider is telling you that you do not need to come into the office, just live life as normal. If you have any symptoms, however, if you feel like you're sick or you have any symptoms, please call ahead. Do not just show up for your appointment. Call ahead of time and make sure that it's okay to come in.
Yeah, and maybe have a mask with you if you're going into the doctor as well. All right, the last question. Are there extra measures we can take to prevent possible spread to those in our own home?
That's such a great question. So if you feel that you are doing something that could have exposed you, like, again, travel, if you've traveled to any of the domestic or within the United States, like New York, New Orleans, LA, Seattle, any of those cities that you may have frequented, or in coming back to San Antonio, then you may want to look at your doing a self-isolation. You can do that within your own home and still protect your family. You might have to be cooped up into your own bedroom, but if there's somewhere in your home that you can self-quarantine yourself and just make sure that you're monitoring your symptoms and not exposing your family, certainly that is something that you can do. You can also take your temperature twice a day and make sure that if anything goes above 99.6, then those might be indicators that you might have been exposed. If it's under 99.6, then more than likely fine. But those are things that you can do from home.
Great. Dr. Dawn Emerick, Director of Metro Health. I know you're very busy. I appreciate your time tonight. And thank you for directing us through this crisis that we're through. I appreciate
You're very welcome. It's my pleasure. It's my pleasure.
All right. We'll be right back.